Recently, I've seen more and more patients with bad outcomes from dental implants. Yeah, I know, right? These photos were actually taken in the last 2 weeks from patients who were seeking help from me. Well, I know what you might be thinking. Shouldn't be too hard to fix, right? In this video, I want to let people know how to avoid this type of situation and also let you know the reality of the situation coming from the doctor's and the patient's perspective. And make sure to stay tuned till the end of the video where I'll go over basically what went wrong with these two cases and how I would fix them. Hi, my name is Dr. Choi. I'm a board certified periodontist since 2011, and I've treated thousands of patients over the years and placed well over 10,000 implants. And in my career, I see, sadly, patients who are unfortunately caught in these types of situations. Typically, patients caught in this situation are very frustrated, sad, or, in the specific example of one of the cases that I showed you, just numb. And they're just kind of looking for a solution for things. A lot of times, patients really don't know what their recourse is or how they would be fixed in a case like this. Now let's talk about some of the issues that we as doctors face. First complexity I would discuss is that when patients have pre-existing implants, then a lot of times those implants may not be ideal. Keep in mind that we're going to be putting teeth on top of those implants one day. And so what you want those implants to be are in the very best condition. If we are going to be putting new teeth on top of those implants, we need to make sure that those implants have optimal bone, they don't have any bone loss issues. And I tell patients to give them a quick analogy. It's like building a foundation for a home. You don't want to have a shaky foundation and to be building a new home on top of that. Similarly, you don't want to be having dental implants with bone loss issues or that implant isn't the proper size before you start placing teeth or a whole prosthesis on top of that. So if we're going ahead and taking out those existing implants, a lot of times what that requires is bone removal, and that causes trauma to the area. And so that trauma is not ideal whenever we're trying to place a new implant to the area. Now, I know what you may be thinking. We can do some bone grafting, right? Well, unfortunately, the topic of bone grafting can actually get very complicated. And not only is it just complicated, but it can add more trauma and more expense to the whole process. I've created additional videos about bone grafting, so I would highly recommend that you watch that video above. In addition to that, a lot of times it's not even just the ideal size of an implant, or maybe there's not enough bone around it, but the actual implant can have an infection around it. Now, how bad is that infection? Unfortunately, whenever there's an infection in that area then doesn't become an ideal implant place to place an implant immediately in that area. So that can also affect things too. Now let's expand on that topic I was just talking about. So if we already have an area that we can't place an implant because there's deficient bone or there may have been an infection in the area, when we're placing all-on-4 dental implants, or if somebody's doing something like implant bridges or a 3-on-6, or even for individual implants, we are trying to pick specific areas where to place your dental implant. So if that area that was very ideal for the spread of your dental implants is now compromised and I can't place an implant there, then that can actually compromise your whole prosthesis. So specifically, we use something called tilted implants on all-on-4, and we place those specifically right in front of your nerves and also right in front of your sinuses. But unfortunately, if one of those sites are now compromised, we now have to pick a specific area, but that might now affect and now make your teeth non-ideal. So what we then have to do is look at more complicated dental implant or more bone grafting procedures, such as sinus lifting, zygomatic implants, pterygoid implants. You're going to have to find a clinician who's more experienced in that area. These types of dental implants have additional costs and invasiveness, so this is definitely another thing that doctors need to think about also. And let's talk about a final point that a lot of doctors don't really want to discuss. If we already have a patient that's coming in that's in a compromised situation, and if we get involved and if it is a very difficult situation, whether again because there was infected implants, bone loss, or now we need to be more invasive with zygomatic, pterygoid, or sinus lifting, then the case becomes a lot more complicated, right? And so what a lot of clinicians will fear is if the patient's already unhappy in the beginning and we are now trying to exceed expectations, when a patient is already fearful of a bad result, then clinicians will be worried about potential lawsuits. Let me give you a specific example that even happened at our practice recently. There was a patient who was treated at a discount all-on-4 center that was always advertising all-on-4s for only $10,000 online. Of course, I've come to know that they were a bait and switch operation, but what they did was they treated the patient. Long story short, the patient didn't have an ideal result. The patient was not able to chew and was having a lot of issues, and they had visited multiple clinics trying to seek help. This patient was actually traveling with his wife office to office, and they finally came upon our office, upon which time one of our doctors, Dr. Choi, was actually able to help this patient by changing out their multi-unit abutments and actually helping them out with their teeth. Well, fast forward to a month later, where the patient was initially very grateful, but because of a question about some sort of insurance, the patient ended up trying to threaten to sue us. So this is another example of why doctors become afraid or maybe even wanting to reject trying to help other patients in these types of situations. Now, before I get into the topic of the issues it causes for some patients, I think one of the best ways that I can honestly help you out is to help you avoid having these issues in the first place. So what I've done is I've actually created a list of questions that you need to even ask before you go ahead with dental implant treatment. So if you're interested in that, make sure you click the information below and you'll get access to that list of questions that you need to know. And also, the whole objective of my channel is to make sure that you guys get all this information so you don't experience these horrible outcomes. Make sure to subscribe to my channel below. And also, if this information is helpful for you, please give me a thumbs up. So let's talk about some of the issues that patients are going to have to experience. Now, let's go over the first one, which is probably gonna be pretty obvious, but you're gonna have to go through another surgery, right? Which is really unfortunate because a lot of times patients were looking forward to that surgery as being, hey, this is gonna be the last surgery I'm ever gonna have to deal with for this tooth again. They don't even wanna go to the dentist in the first place, and they had a surgery and they thought this was gonna be the last dental appointment of their life. But unfortunately, things didn't go right. And so now, in order to fix the problem, you're gonna have to go through maybe one revision surgery, or if things are bad enough, multiple surgeries to get things right. And along with that, what's gonna happen is now it's gonna really expand your timeline. This is why I keep on trying to emphasize in my videos, this is not something that you're gonna be fully done within 1 week, like a lot of people try to market you with. So what's ideally gonna happen is your body just needs time to heal from these types of procedures. Remember, we're involving bone. It's like a broken bone. You're never gonna hear from a doctor or an orthopedic surgeon that they are able to heal your ligament or your bone within 1 week. So there's gonna be a period of time which you're gonna have to wait to basically have an ideal outcome from a surgery. So whatever period that your doctor now tells you that you're gonna have to wait is gonna be that extra amount of time that you're gonna have to. Now here's a really major point, okay? I know what you're thinking at this point. You're distrustful, you're skeptical. You obviously signed up with the first surgeon because you felt that you could trust this person, you thought that they knew what they were doing, but now you didn't have an ideal outcome. So the big question that you're gonna have is, who do I trust? What are their qualifications? I thought they had good qualifications, but I didn't have an ideal outcome. Maybe you feel like they were leading you on. There's gonna be lots of questions that you have going through your head. And then the final question is, well, who's gonna be able to help you out if you thought that you found the right person in the first place? So unfortunately, I can't really help you out with that too much. But again, I'm gonna refer you back to that list of questions listed below. I highly recommend you sign up for that so you can see and get access to those list of questions that you need to even ask on the phone call or bring to your consultation with your dentist. And let's talk about the final point. It's the big elephant in the room. It's gonna be money. Now, if you've been paying attention to the video, what I talked about earlier when we were talking about the doctor's perspectives is that this surgery effectively has become a lot harder for the doctor to take over this case. And I'm not saying it just became a little bit harder. Sometimes I'd say it's like 3 to 5 times harder. Again, we are trying to pick specific places to put these implants. And now because those sites have been compromised, we have to head to more exotic type of locations such as your cheekbones, which are zygomatic implants, or your pterygoid plate, or involve procedures like sinus lifting, which is obviously going to be more expense for the doctor and therefore is going to increase your expense also. So depending on who you see, you're definitely going to see an increased cost on the revision surgery where we basically fix you versus the original cost of the surgery. So unfortunately, there's going to be a lot more costs involved. Now let's talk about those 2 cases that I mentioned at the beginning of the video. This first patient was somebody who saw me about a few days ago, and we actually have her surgery scheduled in 2 weeks. Now she told me a little bit about her story, but she actually had these dental implants placed about a year ago. And unfortunately, from what her story, how it went, I feel like things were not going well and she was taken advantage of. But let's go into specifics. This is what I actually see. Okay, so what we see right now is the patient, we'll be doing surgery on her in 2 weeks, but right off the bat, when we look at the aesthetics, you can see the abutment on this FP1 implant bridge. Unfortunately, there's multiple things going wrong when we take a look at it aesthetically. Again, we can see the abutment, we can see a gap here between her teeth and her gums. That means that they either didn't make the bridge properly in the first place, or the patient has some bone and gum loss in the interim. And then also we know it's something going on right here. Now, if we take a closer look, okay, so you could see here with the patient's cheeks retracted that this is the abutment that was showing. And then also what you see right here, there's actually another implant right here that they decided not to use. And what we also will find out on the 3D scan is that the implant that's supporting here is failing because it wasn't even placed in the bone. It's barely hanging on by a thread, which is why when the patient, the dentist tried to insert this bridge, the patient was feeling pain, so he numbed her up to be able to put this bridge in, but that was happening, again, because this patient, the implant was never placed in the proper position. So let's take a look at her CT scan, right? So this is her 3D CT scan, and then also we have what we call her panoramic X-ray, right? So what we see right here is that this patient had 2 existing implants, but then right now for this, supporting this front bridge right here, we have this 1 implant and we have this other implant. And so let's show you corresponding what those are. And that would be this implant is also is supporting the bridge. Also, we have another implant here supporting the bridge, but this implant is failing. This thing sticking out, this implant was placed at such a poor angle that they were never able to use it in the first place. So going back to the 3D scan, again, this implant, which we could see some bone loss issues right here, and this implant are supporting that bridge. And then when we take a closer, and this is the implant that is sticking out of the gums that they decided not to use. Again, the reason why is because it is at a very poor angle. Now, when I'm looking at a case like this, I'm looking at, all right, if we're going to put new sets of teeth on her, we have to look at those existing implants. And the reason why this implant on the right side is experiencing bone loss is that this right here, guys, is the bone surrounding this implant. So the bone is very, very thin around this implant. And so she's already experiencing bone loss issues on this implant. And then the implant on the other side, where I was telling you that the implant was failing and she was having issues, sadly, this implant is not even in the bone at all. This is the bone right here, guys, right here. And you can see that. And again, we're looking at this from the side view. This is the front lip. This is the roof of the mouth. This is the lower tooth. This implant is just hanging out in air in the gums. So it's not really being supported by the bone. So literally she's saying that this bridge is moving, like, wobbling. And sadly, she says, like, even during the daytime, it like drifts lower. So, that's obviously what the issue is, but let's go back to how do we fix the situation? Well, unfortunately, the situation is now pretty complex because she has, typically where we place the implants, if you're going to be looking at an all-on-4, is that you want to place an implant tilted back here right in front of your sinuses. So we can place an implant back here. And then the problem with that, though, is that the bone is pretty skinny in this area, and also we have an implant right in that area. So will we be able to remove that implant without causing too much trauma to the area? And again, I expressed earlier in that video, that's one of the main factors. The other issue is, again, on the front area, when I want to be placing some implants, we have very little bone now. So we don't know how much bone we've lost due to this implant. And this implant is going to be actually very easy to remove because it's not even the bone. But then we have another implant up here, which was poorly placed at a horrible angle. And the reason that probably happened was because there was very poor bone here. And yeah, that implant will have to be removed. And then this implant on the right side, again, will have to be removed. Not much bone in this area. And then also this implant will have to be removed. And this area is also very narrow bone also. So long story short, the ability to place some implants in the posterior is going to be a little bit difficult. On this right side, I don't feel like we're going to have any issues. We will be able to place an implant for our tilted implant on the back right. But more of the complexity is going to come on this case in the front, on this left side tilted, and also the front area where she's got very little bone, right? So again, being able to remove those the bone not causing too much trauma to the area. So our game plan right now is to be looking at something called a zygomatic implant on her left side and be able to place an implant in her cheekbone. And that's going to be the probably best option for her at this point. And again, we're gonna have to be a little creative with how we place these implants up front, and also might have to do some guided bone regeneration. I'd like to avoid doing something called transnasal implants on her because she's only 50 years old. So now you see why I mentioned earlier in this video that these procedures can become more complicated if there's already existing implants in the area. And comment down below if you want to see me video document her surgery so that we can show you how we've actually fixed these cases. Now let's talk about the second case and what exactly went wrong with her. Okay, so this is another patient who came to us with, obviously, we could see what's going on. She's actually in her temporary acrylic all-on-4 prosthesis. So she had this done back in 2021, so only about 3 years ago. Obviously, we see a huge issue here. There's been some fractures, some repairs on her prosthesis. But when she came to us for help, and obviously she's looking for a new set of teeth, we have to look at, again, the underlying implants and see if the implants are looking good enough for us to be able to restore these. And the best way that we do that is by looking at the x-rays. So you could see up top that she has 6 implants and down low she has 7 implants. But the biggest issue that we see when we're looking for these cases is right off the bat, we want to see if there's any bone loss. And what we see is we have significant bone loss right here, and these implants are just kind of hanging out in the sinus, so there's really no support for these implants. So long story short, her furthest back stable implant is going to be right here, so it should only be able to support a tooth up to here. So we would have to do either zygomatic implant on her or sinus lifting with implants on her. Also, another thing that we noticed is that, I actually have met this dentist who had performed the all-on-4 on her. Very nice guy. But on this case, a large implant was placed in the area for the bone. We can actually take a look and we can see that on this 3D scan, again, for how wide the bone is, the implant is definitely oversized. So way too large of an implant was placed in that area. And also we can see on the photos that this is the implant right over here. Unfortunately, it's cut off from the screen right here, but let me see. There we go. So unfortunately, this is the implant right here, and there's some bubbles from the saliva right in this area, but we actually have thread exposure, just like this patient has right here where she had the bone loss, where she's going to need the future sinus lift. Now, some people might ask me, what is this? These are multi-unit abutments because this patient had thin KG. Sometimes you will see the multi-unit abutments on an all-on-4 case, but it would always be hidden from the smile line. So that's what we see in this case. And then going back to the 3D scan, again, sadly, we can see on this panoramic, she has extensive bone loss on these 2 implants. And if we take a closer look in this area, she has extensive bone loss on these 2 implants, and also she has bone loss on this implant. So she would need at least 4 more new implants if we were to go ahead and be able to try to make this patient a new prosthesis. So sadly for this patient, unfortunately, this patient would be looking at additional surgeries and additional expense. So yeah, this is actually the recommendation that I gave her during her consultation. And I actually recommended that she seek second opinions on this because I always want patients to feel comfortable about what they're going to go through in the future and how to fix their situation. In conclusion, coming from the patient's perspective, obviously you're going to have to go through another surgery, which means added time, pain, and discomfort. So nobody wants to have to do all that all over again. And then the other thing is you're questioning, who do you even trust, because things never went right in the first place with somebody that you trusted. And then coming from the doctor's perspective, anytime there are implants that are not ideal, or there's bone loss, or there's infection, removing those implants can cause more trauma to the area and basically doesn't allow us to use ideal spaces for where we actually want the dental implants to go. And therefore, this leads to increased complexity of the case and increased liability. So the main point of this is make sure that you carefully pick your doctor and also understand about the complexity and the cost of your case. Well, I hope you guys found this information helpful. And I also wanted to point out this other video where I discuss all the things that a lot of all-on-4 providers or dentists won't want to tell you about the whole process. So thanks, and I look forward to seeing you there.